how many of you, by show of hands, have experienced or heard of a traumatic birth? Yeah. Well, I'm here to tell you that childbirth trauma is common, but it's not normal. So I'm going to take you on a journey of a typical pregnancy for a woman now and how it affects not just her, not just the baby, but everyone around her, and how we're going to continue to breed generational trauma into the lives of humanity unless we actually get this at the root, which is childbirth. You may think this doesn't apply to me because I'm a bloke. You may think this doesn't apply to you because you're done having babies, but it does. We are all born. So I urge you to have a little listen and see if you can spread the ripples of love and put a stop to trauma. So the problem we have at the moment as a society, we function with outside stuff. And what I mean by that is external salvation, external validation. We have lost the ability to go inside. We are remaining in our heads, in our egoic construct, and we are living from fear. And it's very, very clear to see the collective consciousness of fear and the result of that. And we have things like 2020. And we are going to keep breeding fear unless we change and shift to love and actually go inside. So while I'm talking, I want you to consider if what I am saying is inside stuff or outside stuff. So is it the roots or is it the fruits? So how do you find out you're pregnant? How does a woman find out she's pregnant these days? Take a test. Is that inside stuff or outside stuff? It's outside stuff. We need validation straight away. We don't have anything in touch with our body. Women know when they're pregnant. They don't need something to tell them they are. It's a feeling. And then we have to go and get a scan. That's outside stuff. Ironically, they look inside, but you know what I mean. And then we have to see the midwife to make sure that everything is okay, because we have no connection to our deep intuition, and we have to hand over our body's experience. And we start to panic from word go from pregnancy. Am I screwing this up already? Now, what's really interesting is that when you're going to see your midwife, when you're booking in for your pregnancy, they'll tell you, don't eat soft cheese. Don't eat liver. And then unless you're eating liver from a polar bear, I can guarantee you'll be fine. Don't smoke. Don't drink alcohol. But when you're in labor, we're going to pump you full of opiates, okay? It makes no sense. But we give away our power almost immediately, because we need external salvation. We need external validation. And we become frightened. At what point do women even learn about pregnancy? When they're pregnant. And by that time, they're backed into a corner. And it's very, very, very difficult to get out of it. It's surrounded by fear. The whole system is surrounded by fear. So I'll give you a very typical scenario of birth in 2024. A woman is told, you're overdue. You've got to come in for an induction. Overdue? What's overdue? So babies have got like a sell-by date or what? It was coined by a German obstetrician called Nagel in the 1800s, and he calculated 40 weeks based on the lunar calendar, and we still use it today. And the midwife will say, if you go over 41 weeks, your chances of stillbirth double. Well, that sounds very scary, doesn't it? But double of what? The numbers matter. If it's 1 in 5 to 2 in 5, that's scary. But the truth is, after 41 weeks, it goes to 1 in 798. And then it drops after that. And we don't know why. So they tell you to come in because they've given you a scan and they've said you've got a big baby. What's a big baby? Do women not have the ability to birth our human beings without need of intervention? Because according to the system, we can't do this. So then you go in to be induced. Now, before I teach you about the induction process, I need to explain how physiological birth works so you can understand the direct comparison. When we give birth to our babies, we have the same hormones as when we make them. You release oxytocin when you have sex, and you release oxytocin when you give birth. It's a love hormone. The beautiful cycle is already in motion. Now, the thing is, oxytocin is a very shy hormone. And if you are frightened, you will release adrenaline, and adrenaline will stop your oxytocin. And it works beautifully for evolution. Imagine a few thousand years ago, you're wandering the tundra and you see a big scary toothy bitey thing in front of you. Your brain goes, don't give birth now, that thing's going to eat you. So you release adrenaline, and all that lovely rich oxygenated blood that's meant to go to your uterus will go to your arms and legs, ready to fight or fly. Now, we may not have the same stimuli in 2024, but we still have it. So can you imagine if you're making love and you're in the most beautiful embrace with your partner? You're looking into each other's eyes. It's euphoric. You are so happy. You are in the present moment. And then someone walks into the bedroom, opens the door and switches the light on and looks at you and goes, what's your national insurance number? Or I'm just going to take your blood pressure. Do you think you could get back into that state, that euphoric state? No. But for some reason, we think the system can work well like that. Well, the system actually does work very well for the system, but not the women using it. So you're going for an induction. Now, there are several methods of drugs that they use to induce, starting from prostin and propes, which are prostaglandins. But usually the big guns come out. And this is a drug called syntocinon. If you are from America or Canada, you will know this as Pitocin. And it's a synthetic form of oxytocin, but it does not work like natural oxytocin. It doesn't go to your brain. You don't get that euphoric, beautiful birth bubble. Instead, your uterus gets rammed over and over again with a very strong, unnatural contraction, and you get hyperstimulation of the womb. Now, because it's so painful, women often ask for an epidural. Who here has had an epidural? Was anyone here told what was in an epidural? Well, I tell you now, it's 50% bupivacaine and 50% fentanyl. They don't tell you what's in it. So they give you an epidural and you're rendered on your back. How can your baby come down if you are laying? Would you go for a poo lying down? Unlikely. You can't use gravity to help bring the baby down and get into the pelvis correctly. So they give you this epidural. You can't feel the extra pain of the contractions if the epidural has worked correctly. But then because you're on the epidural, it slows down the labor. So then they up the syntocinon. And then they up the epidural. And then because of this cycle, ongoing cycle, your uterus is being smashed over and over again with these unnaturally strong contractions. And it compromises oxygen flow to the placenta. And baby goes into distress. And all of a sudden, you've got a load of people in the room, your CTGs beeping, 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 which are the monitors they put round you. And the woman is rushed in for an emergency cesarean operation or into theatre to have a ventouse or a forceps instrumental delivery. And these poor women end up with some sort of Stockholm syndrome. They thank the people that have just done that to them. Thank God I was at hospital, otherwise I would have died. If you weren't there, that cascade of interventions would never have begun. And then when you have a woman who feels her body has failed her, and I can guarantee you, if this is your story, which it is of many, many women, your body did not fail you. The system failed you. But when you have a woman who believes her body has failed her, she will acquiesce to anything. And then you've got a client for life for Big Pharma. And this is how it starts. So a baby is born. Our children are being born into a sea of cortisol and adrenaline. And they should be born into a sea of oxytocin. So the mother thinks that her body's failed her. How can she breastfeed when she's got that much adrenaline surging through her veins? How can she feel relaxed enough to breastfeed? So then she can't breastfeed. She feels like a failure at that. And all of a sudden, she's being diagnosed with PTSD, or it could be postnatal depression. Oh, we got a drug for that. Take this drug. And then after that, I don't want any more children. Cool, go on the contraceptive pill. That'll screw up your endocrine system eventually, and you'll need a drug for that. And so it goes on. If we can get birth right, we can sort out anything. Now, it's all well and good knowing all these amazing things about how your body works, how physiological birth works. Now, obstetricians, so doctors who attend women in labour, have a very tenuous grasp on physiological birth. They are there for when things go wrong. They are there to help medically. But we are really losing women who actually understand physiological birth. It used to be the crux of midwifery. But if I had 100 midwives here today, and I said, hands up last time you saw a physiological birth, maybe a few would go up. And if I said, put your hands down if that woman had a vaginal exam, hands would go down. Put your hands down if that woman had a CTG monitor. Pretty much, sooner or later, you'll have no hands up who's actually seen a physiological birth. Soon I'm going to have two of my colleagues up here talking with me for the panel. And they will both agree, they're also former midwives, that midwives are losing the skill to understand how to facilitate physiological birth. We're becoming obstetric nurses. And when push comes to shove, which is my company, we are now in 10 countries and we help facilitate physiological birth. And I teach people to do what I do. And we have a 77% home birth rate. And that is compared to just under a 2% national average. 100% of our babies breastfeed, and we have only a 7% C-section rate. And if you look at the actual true statistics, we are approaching a near 50% C-section rate. So 50% of human beings need an operation to be born. I don't think so. Now, I want to briefly talk about the handmaiden complex that women are experiencing. Because we are so separated from our authenticity and we're in our egoic construct. And let me just do a bit of explaining to understand how we've got to this point, because we need to know how we've got here in order to heal the world and heal the generational trauma. When we're born, we're the most authentic we will ever be. We cry when we feel to. We make noise when we feel to. Now, the trouble is, and it's not our parents' fault, they have done the best they can. But parents, generally speaking, cannot handle authenticity because they don't have the tools to regulate their own emotions. So what happens is a child will have a choice between being authentic and an attachment. They will choose an attachment every single time because it keeps them alive. So when a child does show their authenticity, you often get parents going, stop doing that. It makes me feel like this. I'm reacting. I'm not responding. And the child starts to develop an ego. And an ego presents in different forms. So you've got a victim. We all know victims. Oh, typical. This has happened to me again. I can't get ahead in life because of this, that, and the other. Then we got saviors. I can certainly identify with that complex. A few years ago, we have to fix other people. We got the bleeding empath. We feel, oh, I feel so sorry for you. I'm going to do everything I can to help you, because we can't sit with our own uncomfortable feelings. This is generational trauma. And if we don't cut this, we're going to see problems. But we have a privilege now to be able to do this inner work and heal. When push comes to shove, it's not just about birth. I run courses called Heal Her, so we can transcend this generational mother wound and we can begin to heal. But as I was saying earlier, we have come into this handmaiden. And what I mean by that, because we are so used to outside stuff, I need a pregnancy test to validate this, I need a scan to validate this, I need my midwife to validate what I'm thinking, and if she doesn't, I need to go somewhere else to find someone else. What about inside? Because the presence of intelligence without wisdom is dangerous. Women need to connect with their internal wisdom. Now, I have a course, myself and Angela Chamberlin, who's here today, we have a course called Artemis Academy, and it's a year long. We teach birth keeping skills. And in the first module, we show a very, very disturbing childbirth scenario. But unfortunately, it's pretty common. So a woman is laying on her back in lithotomy position, and she's got her legs open, and she's got a male doctor between her legs. She's got an obstetric nurse to her right, and her mother, who is also a handmaiden in this story, is sitting there too. The obstetrician says, I'm going to cut you now. And she says, I don't want to be cut. We haven't given a chance for the baby to come down. And he starts shouting at her. He's triggered. He's got a control complex. That's triggered it. So he's like, well, you're going to do this on your own? I've been a doctor for how many years? You think you're a professional? And then he says, your vagina is this big and your baby's head is this big. So already it's very clear he has a very tenuous grasp on the perineum of a woman. He doesn't understand that it's quite elastic. So she protests. She's got her mother saying, do what the doctor tells you. Because she's got a handmaiden. She's also a handmaiden. She has absolutely no connection to her internal wisdom. Well, it is there because there's something inside saying you don't need this. But she can't advocate for herself because she's here and the doctor in the scrubs is up here. She's got the nurse telling her to shush. And the doctor takes a pair of scissors and cuts her perineum 7 times. And the mum claps. Oh, the baby's here. Well done, doctor. Thank you, doctor. Now, I'm not here to say that there is no place for medical intervention in childbirth. That would be wrong, because there is. And medical intervention saved my life at one point. I broke my back. But what I am here to say is I don't think people realise just how small a number of women will actually need intervention. But when you start the cascade of interventions, the prophylactic scans, and we're going to give you antibiotics for this, it will start a snowball effect and birth will be sabotaged. You don't need a midwife now, you need a human rights lawyer. But luckily, that is what we do at When Push Comes to Shove. We train all our candidates in human rights in birth, how to navigate the system. We have an incredible network in 10 countries of wise women who understand physiological birth and know how to support one another. Now let's just talk about a standard procedure that happens. Vaginal exams. Did you have one in labour, ladies? Yeah. Why? Why? Might have fallen out back there. Why do we have vaginal exams in labour? Yeah, but why? Why? They do want you to get to 10 centimetres. But if I were to examine you now and you were in labour and I found you at 5 centimetres, where does that tell me you're going to be in 2 hours? Nothing. Now, unless your cervix is a crystal ball, all it's doing is introducing infection and stimulating adrenaline potentially, especially to women who have been abused, and that cervix can close back up. And they wonder why women fail to progress. Women come away thinking their bodies have failed them. They have not failed them. And the problem is the education system, and we have to start at the top, which is Big Pharma. Big Pharma will fund the studies which will prove certain interventions need to happen, and this is drip-fed down into midwifery, and this is what midwives and doctors learn. Now, there's one thing in particular that we teach at Artemis and When Push Comes to Shove, and it's the correlation between blood volume expansion in pregnancy and protein. Now, midwives aren't taught this, so therefore it's not taught to their patients, and therefore we have a huge scale of unnecessary ailments during pregnancy. Have we all heard of preeclampsia? Right. Why does that happen? Does anyone know? No, they don't know either. You might get the odd, oh, well, it's genetic. If your mum had it, you're more likely to have it. But if they actually understood the correlation between blood volume expansion and protein, I think we could eradicate most of the cases of preeclampsia. So when you're pregnant, your body has to expand its blood volume by up to 60%. In order to do that, your liver needs to perform 500 metabolic processes. In order to do that, you need 100 grams of protein a day for a singleton pregnancy. Now, say you're at the end of your pregnancy and you haven't expanded your blood volume correctly, your body thinks it's hemorrhaging. So it starts to draw water out of all your cells. And what happens when you start holding water? You swell, your blood pressure goes up, you get preeclampsia. So I'm going to welcome to the stage now Angela Chamberlin and Jenette Forkner. Thank you very much. Thank you. So I'm going to ask to both Angela and Jenette, what is your opinion? Why has midwifery become so over-medicalised in the last century? Angela, if you want to go first.
Yeah, hi everyone. I'm Angela. I was a midwife in the NHS until about 5 years ago. I was a midwife for about 12 years. I became very disillusioned with what was going on. I was a frustrated midwife because I could just see this over-medicalisation of birth happening day by day. Women leaving their birth experiences, instead of feeling like an absolute goddess and being empowered in their experience, feeling downtrodden, traumatised. And as Nickita's already touched on,
Angela, move over here.
if a child is born in that state of trauma and things like that, it has a ripple effect on the whole family. So if that woman comes away from her birth experience feeling like an absolute goddess, that is going to have a similar ripple effect. It's going to help the relationships with her partner. It's going to help her bonding with her children, as opposed to this traumatised feeling that women were getting. And I think a lot of it, which Nickita's already touched on, is when I was working in the medical system, all the policies, all the guidelines, all the procedures, all the interventions are fear-based. They're all there in fear of litigation. Obstetrics in itself, if something goes wrong at birth, they're paying out a lot of money for the rest of that child's life. So they are scared of being sued. They're scared of litigation. When these things go to court, the people that are in the court standing there have got no clue about childbirth. They've got no clue about physiological birth. What they will look at is, what interventions did you try? So you had all these things available to you. What did you try? So when they go to court and a hospital can say, well, we did this, this, this and this, and we did every intervention possible, and there was still a poor outcome, from a legal perspective, they tried everything possible. Nobody thinks outside the box that maybe if we didn't have this cascade of intervention, we wouldn't have ended up with that result in the first place. So everything is fear-based. Women are constantly told, you're not allowed to do this. How many people have you heard, oh, I'm nearly 42 weeks, I'm not allowed to go past 42 weeks because my placenta's suddenly going to combust or something? Do you know, we're told that we're not allowed to do things as women. As women, we need to take our power back. We need to remember that we are badass. We bring life into the world through our portal. Do you know, like, we are amazing. We can nurture and provide food for that child for the first years of its life. And we've forgotten all of this as women. So we need to take that power back. Stop handing over the responsibility to somebody else. We need to take that responsibility, and that starts with creating awareness, education from a young age. So many women that I come across and speak to were like, I didn't realise that I'm allowed to have a home birth if I want one. I'm allowed not to have a midwife in my pregnancy. Women don't know this. They automatically get pregnant and think, I have to see the midwife, I have to see a doctor, I have to follow this medicalised path, which comes from fear. It doesn't come from love. And when I was a midwife, I was coming across third year. As a midwife, you train for 3 years. So at the end of the 3 years, you become a qualified midwife. I was coming across third year midwifery students, and they were coming to me, and I'd say, how many water births have you seen? How many women have you seen give birth to their placenta without drugs? And they were like, oh no, I haven't seen that. I was like, how many women have you seen give birth on all fours rather than on their back with their legs in stirrups? And they're like, no, haven't seen that. And I was petrified that the next generation of midwifery, we were going to lose years and years of ancient wisdom. We've been giving birth forever, do you know? And in the last 50, 60 years, we've become so over-medicalised. We've lost touch with ourselves. We've lost touch with the true purpose of it. And it all comes from this fear-based, fear of litigation, fear of being sued in this patriarchal environment. And that's where we need to come together. We need to be wise women supporting women and creating these loving environments so women can be empowered in their experiences and understand and take their power back. And it will make a massive difference. Like's already been said, peace up on earth definitely begins with birth. And if we can start having these more positive experiences and women wanting better for themselves, better for their daughters, better for their granddaughters, then that's where we're going to start to see changes.
Thank you, Angela. Jenette, do you want to give your your take on that? Thank you. You might want to use this mic. Thank you.
So,
Jenette.
So I come from a slightly different perspective in that I trained, I think, when the ARC was still around. And it was a bit like Call the Midwife when I trained. We had, the team I was on had a 40% home birth rate. Because we went to people at home and we asked them, if you're okay, do you want to stay at home or do you want to go into hospital? And we had a lot of normal deliveries. So I trust in the birth process. I ended up leaving because I actually got a vaccine injury from hepatitis B, which we all had to have. So I came out. So I've actually got a really interesting perspective. I've gone from 30 odd years ago training, and I had to train as a nurse first as well because it was pre-degree as well. So it was like proper training. Don't tell them though. But I've come back again and I see real change has gone on and how much fear now is involved in childbirth and how much responsibility women are giving over to the medical profession for their births. Can you hear me? Is that better? Okay. I say that, so I've seen a real difference going away and coming back. How much responsibility women are giving over to the medical profession. Water births were like hen's teeth. They were all land births. We hardly saw them. We had doctors that were going, oh no, you'll get a water embolism. You can't have a water birth. It was all about the fear. But what's important is trusting your bodies, allowing yourself to know that you have that ability. If women can take that back again and have faith in themselves and start having the faith that they can understand their babies, they know if there's an issue or not. You know if your baby is struggling. Every single mum who's been pregnant knows if their baby's in trouble or not. But we don't trust you to do that. We don't trust you to say, I'm not happy. They dismiss you as, oh, you're making it up. Oh, you're just panicking. First time mother, what's wrong with you? You know what's wrong. And we need to get back to trusting people that they know what they're doing. And that's all I'm going to say.
Thank you very much, Nat. Thank you very much. I'm going to ask another question to the panel in a second, but before I do, I just want to remind you, if you want to train with us or you know someone who's pregnant who could do with an independent birth practitioner who understands holistic birth, please go to whenpushcomestosshove.co.uk. You can find us on Instagram, when.pushcomestosshove, and we're also on Telegram, but it's called Awakened Pregnancy and Birth there. You can train with us, tell other people, come and birth with us. And then brings me on to my next question. Angela, if you want to come over here. How many of your patients have had C-sections since you've been a birth keeper?
One. And that was due to an anatomical reason in her pelvis rather than there being any kind of thing. Her pelvis wasn't designed for her to give birth, which is very, very rare. But yeah, since I've been working as a birth keeper, just one of my clients has had a C-section. And in saying that, that lovely client stayed at home until she was 10 centimetres with no pain relief. She just had a pool and affirmations and a really good supportive environment. And she felt empowered by her birth. She knew that she needed to have a cesarean, and that was, how it was. While I'm here, I just want to add one thing about Nickita saying about the training. Our dream is to go old school. There should be a wise woman in every town, in every village that women can turn to, that they can get supported with physiological birth, and that's what's going to make the difference. We can't do it by ourselves. We need to build an army, and that's why we train people to do what we do. And if you're interested, look us up. I think Philly's got some of our leaflets on her stall as well. But yeah, thanks for listening to us today. We appreciate your time.
Thank you, Angela. Thank you so much. And I have a question for Jenette. So you were a midwife in the system and you have now been a birth keeper.
Yep.
Do you see women at home screaming for pain relief, Jenette? Mike.
Not as much as in hospital.
No.
It's definitely more scary in hospital.
What percentage of your patients would you say transfer to hospital?
I would say it's nowhere near as many as I thought it would be when I started. It's pretty good. I have not that many.
Fantastic.
At all.
Well, in my 15 years of being a birth keeper, my personal C-section rate is 3%.
Yeah.
In 15 years. But the NHS would want you to think that's going to be nearer 50.
Yeah.
And I think that just shows that the pelvis of a woman in 2024 is perfectly safe. Thank you very much.
Yeah, and I'm on.
Yeah.
I tell you, no, 90% normal delivery rate.
Yeah.
I've got.
Women of Earth, take back your birth, eh? Angela, I just wanted to ask you another question. What is the difference between working in the system as a midwife and working as an independent birth keeper?
Not going to lie, giving up my job was very scary. Giving up salary, sick pay, all of that. But I was a frustrated midwife, and I felt the role that I was doing was not helpful. It was soul destroying. Now I feel like I'm a real midwife. What I do is I am with women. I will support women throughout their journey. I support their families, their children, their in-laws. And I'm really able to advocate for that woman's wants, wishes. And everybody's different. We've all got different needs. And being able to provide that individualised care and not be on a clock and not be a one-size-fits-all approach, which you get from a medicalised system, I truly feel that I'm actually doing the job that I thought I signed up to do all those years ago. And this is what women need. They need that trusting relationship with somebody that can guide them. And I feel that that's what I'm doing now as a birth keeper. So if anybody else is called and feels like they want to become a birth keeper, come and chat to me, and we can definitely put you on the right path. Because my job now, it doesn't feel like a job. I am privileged to do what I do, and I absolutely love it. And most of the time, it doesn't feel like work. I become part of that family. I get, updates all the time from babies when they have their first steps, when they've said their first words. And it's just absolutely wonderful and a privilege to be part of. And if that's something that calls out to you and it thinks maybe you fancy a career change, come and let us know, because it's perfectly doable. And it's a brave step to give up a salary, but I don't have zero regrets. They've asked me to go back to the NHS on several occasions, and I've politely declined. I have offered to go and teach them about natural birth, but they haven't taken me up on that offer yet, so we'll see.
Thank you so much. And you've been asked to go and teach, but we've also been asked to go to Uganda and teach the lay midwives out in the village. We've been able to expand what we do. We go out all over the country and talk to women everywhere. And Angela teaches at universities. We lectured at a midwifery conference last year. Jenette is also one of our mentors. So when push comes to shove, if you train with us, you'll find 10 mentors all around the world. Jenette is one of our mentors. Angela is also a mentor. And it's not just training. In fact, when you learn birth education, it's almost just superficial unless you do the inside stuff. And when you come to when push comes to shove, we do the whole lot. We cannot have women going to births who can't regulate their emotions. We need women who are strong. We need women who actually know who they are. And I am so proud to say that there are some women here today, part of When Push Comes to Shove. I would never have been able to do this without you and your love and your support to make what we have today, this sisterhood, this tribe, this incredible movement. And thank you so much. Jenette, do you have any final words for everyone?
Just to reiterate what Angela was saying, I feel more of a midwife now, as in with woman, than I did when I was a midwife, because it's that all about supporting the woman when she's giving birth to her baby. And if she has that support, she doesn't have to worry about anything, and she can just go with it. And that's what I love about my job. It's giving the woman that support that she can just give birth in the way she needs to.
Amazing. Thank you so much. Thank you to Angela, and thank you to Jenette.